Hello, my name is Marshall Thomas, and I'm here to talk to you about CPR and first aid. This is just an overview, and I encourage you to take a class and get certified on CPR and first aid. Most of the time, when you're dealing with CPR first aid need, what you're going to be running into is your child or someone else's child is unresponsive, and this is going to be the scariest one. Uh, if it's an adult, we process a little bit differently and we can handle it a little bit better. So the key is to train, do your annual re-ups for your certification, and be ready for it. That way you are learning how to do things in a non-stress environment, and you can do them better in that stress environment. The guidelines for CPR have probably changed since you took it or since you were exposed to someone else who had taken the training over the years. And they're currently at a compression ratio of 30 to 2. What does that mean? Basic. It's that you're going to be pushing on the chest 30 times, then providing 2 breaths. Those 2 breaths are where you're going to take your mouth, you're going to put it over their mouth, create a seal, and blow in. If you've learned back in the past, you're going to remember the head tilt chin lift to open the airway. We don't do that anymore because of the risk of doing damage to the neck. Now, if you are a certified ALS provider, someone who is a nurse or a paramedic, uh, that area, then it's a different set of rules, different set of skill sets. Uh, for us lay people, you're going to just blow into their mouth. Now, the compressions are going to be with your dominant hand on the bottom, your non-dominant hand on the top. For me, that's my right and my left. And you're going to interlace your fingers, place your palm right about 2 finger widths below their nipple line, which is right on the sternum. And that's where you're going to push. This is for an adult. And for a larger child, you're going to push in and you're going to lock your arms and be bent over like this and just do your compressions that way. Your child CPR, that was adult and large child. For your small child, you may use one hand, same positioning, nipple line 2 fingers below, and pushing, okay, and locking that arm so that your whole body is moving as one. You're trying to get the chest to compress about 2 inches. It takes a lot of pressure. It's not unusual to crack a rib or break the sternum. That's okay. Uh, and you just continue your compressions. The goal is, again, to do 30 and 2. It's 100 compressions per minute. It's 100 compressions per minute, by the way, whether it is an adult or a child now. And the 2 breaths, if you are not comfortable giving those 2 breaths, if there's blood involved, or this is someone you do not know and you do not have a barrier mask, which I suggest you also get, and you should get during your certification training. If you don't have a barrier mask, then you may not do the chest compressions, and that's also okay. Or, no, I'm sorry, you may not do the ventilation, and that is okay. The goal is now, under the current guidelines, to give us the 100 compressions per minute. You have to keep the blood circulating. There's still oxygen in that blood. You need to keep it circulating. For a child, small child, you're going to do the same thing. You're going to find infant. You're going to find the nipple line, and then on the nipple line, you're going to compress with just your fingers. You're going to, again, lock everything together so that you're not bent your fingers and you're not going to flex. Keep them straight, and you're going to be pushing straight down on the sternum. And again, 100 compressions per minute, 30 and 2. You want to keep the compressions going. The goal is to keep the compressions going and keep that blood circulating. And then as you break at that 30, then you give 2 breaths. And again, you're going to make a seal around their mouth and nose on an infant and blow. And you should see their chest rise and fall. If you see their belly rise and fall instead, you're blowing air into their stomach instead of their chest. And you just need to back off a little bit. Also, it takes a little less breath to blow into an infant than it does to blow into an adult or a large child. So just watch that chest rise. If you note, if you've taken CPR first aid before or you remember seeing it on TV, you're going to recall that someone's checking for a pulse. We don't do that anymore either for lay people. If you are a certified professional, then yes, absolutely check for the pulse, follow your normal protocols. But for a lay person, we're not checking for a pulse. You're assessing the situation to start off with and assuming that they're in need of CPR, therefore their blood is not circulating. We don't need to be checking for a pulse. So you come upon the situation, and now we've got those basics out of the way. You come upon a situation, and